Hi there, my name's Keith Ashstains and this is my reflection using the Bass model on the simulation we did in class. And starting with phase 1, self-awareness, basically from start to finish during the simulation, I felt a range of emotions. Mostly nervous, yeah, and a bit of excitement. Before entering the room, the tutor mentioned that I would be going to a traumatic cardiac arrest. I was nervous, yeah, definitely. But I was also confident that my knowledge and skills will get me through this. My main thoughts as soon as I entered the room was safety. Scene safety. Make sure I'm safe and everyone else is safe. After that, going for a pulse, finding out there's no pulse, my thought process completely stopped. And I just went into an autopilot where I went into a normal cardiac arrest, starting with compressions, ventilations, and defibrillation. That's basically where my mind went from there and clouded my judgment. After a short time, I did actually clear up my thoughts and start remembering I need to fix things. But basically, to do that, I just couldn't remember what I needed to do. So I went, let's go with my ABCs. My thoughts were, what ABCs need fixing and what can I do to do it by constantly reassessing the patient. Yeah. In phase 2, I'm to describe the situation. Basically, my role was the primary responder with one secondary, a patient, and a bystander. The other students had various roles like recorder, timekeeper, note taker, and all that. And then there was the tutor who ran the simulation. When I entered the room, the tutor described this magnificent scene. However, I was looking at a mannequin on the ground in a classroom with a bicycle next to it. The magnificent scene was a car had hit a cyclist on a main road with lots of bystanders, and they were controlling traffic to make it so that we could get there easier. With this, I did my approach like I mentioned before, check for scene safety, check for pulse, went into compressions. With that, that's basically what I did. I did compressions. We got defib pads on, rotated out, went into that approach basically, just followed along that. Then, as I mentioned, I got my iGel in to get some airway access, some BVM, and all that. And that's when my brain started flowing, and I went, we need to fix things. So my secondary, I asked them to get a pelvic binder on. Then I got them to decompress the chest because I was having issues with ventilation. And then I got them to get some IV access as well. And then even at the end, I got them even to start putting a splint on the open femur fracture as well, which was a Slishman. Hearing all this, we also even managed to get ROSC through all of these actions, rotating out the bystanders as they got fatigued while doing compressions. And yeah, we even got to do some post-ROSC cares before the simulation ended. Through all this, up and down with my emotions. Like I said, though, tunnel visioned on my thoughts until they started clearing up and I started actually working on it properly. Phase 3 is reflection. Overall, my goal was to treat the patient who was in traumatic cardiac arrest and bring them back if I could, or at least fix what they had wrong. I checked for scene safety, not just for me, but for everyone that was involved. The CPR, I started that just simply because no pulse, and I didn't think it properly. My iGel, I needed to take it out and reinsert it because there was resistance. I thought there might have been a blockage. Turns out it was a tension pneumothorax that I needed to decompress. These are things that happened that I forgot, that I didn't notice at first, mostly due to difficulty imagining the scene that was going on. As the simulation progressed, like I mentioned, I remembered the traumatic cardiac arrest. I needed to correct the cause of the arrest. In this, it's the 4 T's and 4 H's. Not all of them are applicable, but it was specifically hypovolemia, tension pneumothorax, and hypoxia. Outcome was ROSC, which is the survival of the patient, which made me feel great. Like I actually did something right. The simulation as a whole felt really good, with minimal mistakes throughout, and everyone did their part. However, now that I've had time to review my simulation and that my fellow students gave me feedback. There were multiple small errors, specifically the order of operations I chose to do. Phase 4 of this model is knowing. So basically, I'm looking at the internal and external factors that influence my experience and my decision making on this event. For my internal factors, it was basically my level of knowledge. I'm a third year student, I know quite a lot, but I lack the experience to make the clinical decisions and link it all together, especially when visualizing a situation. If I've never seen something, it's very hard for me to visualize what it should look like with someone else's description of it. Other things that occurred was my tunnel vision. This influenced me greatly. Mostly, I just got stuck focusing on one thing when I should have been looking all across the entire scene and noticing a lot more. Thanks to that, I forgot to ask questions. You know, the most important thing, find out what actually happened. I forgot to do it. With this, that then links back into my experience, lacking the experience to be able to make these connections and the decisions and knowing what I should be doing next. The environmental or external factors would have been related to human factors. So the fact there's bystanders, there's my secondary, there's a person in front of me that's a patient. It's just delays with that, or communication errors, which I don't think there were really any in this one. But these are just factors that influence my experience and my decision making based on the knowledge and the information I gained from them. Other things were like the simulation lacking realness. So with that, it's my lack of ability to visualize, but without having the actual situation, it's hard to do that at the same time, especially when I've not seen it. Noises in the room, especially like the defib going off, which I'm not used to. Whereas also distractions, just other people being in the room. I'm not used to that, especially with my experience on road. The other part to phase 4 is what sources of knowledge did I or should I have used to influence my decision making and actions in this situation? So the ones that I did use was my own knowledge and experience. As I mentioned, great knowledge, lacking experience. But with that, I should have used my own access to evidence-based practice, which is the clinical practice guidelines provided by QAS to guide us on how to deal with these situations, especially since there's one directly linked to a traumatic cardiac arrest that tells me the correct approach, what order I should be doing everything, and what I should move towards if I'm not getting the results I want. Other things that I could have gone to get sources of knowledge would have even just been my secondary. However, I asked them, since this is a simulation to test me, to sit back and let me do everything and guide where we're going, and I will ask if I want help. Like I mentioned as well, I forgot to ask bystanders more questions. So I didn't access a source of information that was right in front of me. With all of those combined together, I could have had a lot better clinical reasoning and decision making to treat this patient a lot more successfully and in a more holistic approach. Phase 5 of the model is evaluation. In this, I basically feel I could have dealt with the situation differently. Specifically, following the clinical practice guideline for a traumatic cardiac arrest, correcting the hypovolemia with IV access and running fluids, and a pelvic binder to reduce any other further blood loss down that area. Correcting the tension pneumothoraxes by a dual decompression of the chest, and then putting limbs to length. They don't need to be splintered, but limbs to length at least helps in the situation. Then starting compressions and ventilations after doing all of that. So basically, I did all the right interventions, but in the wrong order. Things that went well were very clear, concise communication between everyone, not just me to my secondary, but the secondary to the bystanders, or the bystanders to me. Everyone was very great with that, and it sounded great. Then there was also the recognition of the fatigue for the bystanders. So me noticing that, oh, my bystander who's doing compressions is getting quite tired. But the great thing about the simulation is that I had a large group of bystanders standing right there that I could make use of, getting them to do compressions. And then after that was doing monitoring of the patient throughout the arrest to notice signs of ROSC so that we didn't keep causing harm that we didn't need to, because compressions take their toll on the chest. In this patient, it was a spike in end-tidal CO2, and then continued assisted ventilations for post-ROSC cares for this patient, hoping that they don't arrest again in our care. I believe I led the scene quite well, with clear communication of instructions of what I wanted, and literally my secondary and bystanders did exactly what I wanted, so I can't fault them at all. Phase 6 of the model is learning. From this experience, I feel feel great. I've learned so much, especially where some gaps still lie in my knowledge, especially thanks to the clinical debrief we did at the end of the simulation as a group, where everyone discussed where I went well and where I could improve to make this situation mesh well and do a great benefit for my patients. Through this, I decided I'm going to need to deepen my understanding and broaden my knowledge, as I don't actually know the answer to every simulation that we have. Through that, I'm going to need to go back through my CPGs, find what I'm missing, but not only do that, practice them in simulations, not just in the simulation room, but I can do verbal simulations with my friends at home. With that, I'll be able to learn more, but the main thing I need is experience. I need a lot more experience in a variety of simulations and out on road with real patients. Through all this, over time, I'll become a much better clinician for all my patients and do a much better job. Thanks for listening to my reflection on my simulation.